We are Black American members of the National Academy of Medicine,
the premier health science organization in our nation.
We are scientists,
physicians,
healthcare professionals,
and public health experts.
We are also sisters,
mothers, wives, and daughters.
We are brothers,
fathers, husbands, and sons.
We are your neighbor. The person in line at the grocery store checkout. The person sitting next to you in church. We are members of the Black community.
Many of us have fought our way into healthcare professions specifically to care for our community.
Many of us have devoted our careers to exposing racism in healthcare.
All of us have focused our careers on improving health for all.
That is why we support the COVID-19 vaccine, and we encourage you to get vaccinated.
Trust in government does not come easily for our community. Too often our health has been ignored and even abused.
It is not surprising that polls show that many Black Americans are hesitant to get vaccinated.
We understand why.
But COVID-19 is very serious.
And it has a devastating impact on our community.
We have come through so much over the years.
Now we are facing another life-threatening challenge.
We must do what we have always done.
We must choose to do what is necessary for our community's survival.
As health professionals, we understand the science.
As members of the Black community, we understand your distrust.
We have reviewed the research.
Some of us have participated in developing the vaccines, designing the studies, and monitoring the results.
And we are confident the research was done correctly.
Many of us have already received the vaccine.
The rest of us will get it when our turn comes.
We encourage you to claim your place in line to get vaccinated.
Do it for yourselves.
Do it for your loved ones.
Do it for our community.
Do it because we should not tolerate one more preventable death.
Coping with COVID with Tre Tailor. Updates on the pandemic and information to help you thrive and survive COVID-19. Brought to you by SCDHEC. Visit scdhec.gov for testing and vaccination sites. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council presenting Wellness Wednesday every week on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Agape Counseling and Training Services. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, offering free rides to get your COVID vaccine. Don't miss your shot. Visit catchthecomet.gov. Javis Financial Services, with over 20 years of experience. Computers Unique, Dutch Square Mall. Honest, professional, reliable computer sales and service. Palmetto Media Connections, connecting media and communities together. Coping with COVID from SCDHEC. In it together, SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Javis Financial Services, Computers Unique, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
For joining us for Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. I am Tre Tailor, and today we are going to talk about pandemic aid for foster care children. Connelly-Anne Ragley with the Department of Social Services joins us to talk about that incredible new program, and we'll hear from two teams who are benefiting. Connelly-Anne, thank you so much for joining us again.
Hi, Tre. Thanks for having us on, and always a joy to join you and your viewers and your listeners on Coping with COVID. I'm so excited. I can't talk.
Thank you so much. I appreciate it. I hope it's me and not just because it's Friday.
No, absolutely not. And we're talking about a really exciting and announcement from the Department of Social Services. So we're definitely excited to be with you today.
Well, we're excited to hear about it. Thank you so much. We're also going to talk to Rozalynn Goodwin with the South Carolina Hospital Association. I've been telling you for the last couple of weeks that the ACA, Affordable Care Act, Healthcare, Obamacare, whatever you want to call it, the deadline has been extended. And not only are there benefits if you have not registered for healthcare, but if you are registered, there's even more incentive for you to log back in and see what other benefits you can get. Rozalynn Goodwin with the South Carolina Hospital Association is here to tell us all about it. Roz, thank you so much. I don't hear her. Well, we're going to talk to Rozalynn Goodwin next, and of course, Connelly-Anne Ragley. That and more next on Coping with COVID. But first, your COVID community updates. Prisma Health is moving its COVID-19 vaccination site from Gamecock Park to Colonial Life Arena. Now, the move is designed to help accommodate the warmer weather. The last day for the drive-through site at Gamecock Park is tomorrow, Saturday, May 1st. The Colonial Life Arena vaccination site will open at 8 a.m. Wednesday, May 5th. Now, it will operate Monday and Tuesday from 11 a.m. to 7 p.m. and Wednesday through Saturday from 8 a.m. until 5 p.m. People can continue to register for their vaccinations directly through MyChart at prismahealth.org/vaccine or call Prisma Health COVID-19 hotline at 833-2-PRISMA. And the South Carolina Forestry Commission is issuing a statewide red flag fire alert effective throughout this weekend. Now, this is discouraging people from doing any outdoor burning because weather conditions present a heightened risk of wildfire. Now, weather forecasts for most of the state over the next several days include very low humidity and dry conditions, which create the potential for outdoor fires easily and spreading rapidly. SC has your most up-to-date list of times, dates, and location for COVID testing, flu, and vaccine shots in South Carolina. Visit scdheck.gov for more information. Also, you can visit gogettested.com. There you can make an appointment, get locations, and results in 48 hours. The DHEC Care Line is still open and available for testing, vaccines, organizing a COVID screening at your event or at your neighborhood, and transportation to get a test. Now, speaking of transportation, Richland and Clarendon County paramedics are actually offering in-person COVID screening. Call 911 for more information. There are several vaccination clinics open and available in and around South Carolina. Just told you about one at Gamecock Park that is moving to CLA. And there are a couple of others that I want to mention. Columbia Mall Vaccination Clinic. Now, that one is open 7 a.m. to 7 p.m. every single day. And also for anyone 16 or over. You can walk in, you can drive through, you don't have to have an ID, and they also have Spanish speaking and sign language interpreters available. That's at Columbia Place Mall. COVID vaccines are also being held at the Lexington Medical Center. As a matter of fact, many of those locations have been moved to from appointments to walk-ins, so definitely check that out. And also at Benedict College, the Benedict College vaccination site is up and available 10 a.m. to 4:30 p.m. Monday through Saturday. Now, if you are a veteran, all vets are being served with their COVID vaccinations at the VA. You can see the information on the screen. If you are a veteran, make sure you call and visit the VA so that you can get your COVID vaccination. Now, there are several pharmacies and retail outlets that are offering the COVID vaccination in and around South Carolina, including Kroger Pharmacies. They're offering the COVID vaccine. See the screen for more details. CVS is also offering COVID vaccination. See the screen for more details. Now, these are also CVS stores that are independent and also inside Target stores. Those locations are offering the COVID vaccination. If you are a senior citizen and having some challenges making an appointment for your vaccination, Get Set Up can help you. Now, they won't make your vaccination, but they will certainly help walk you through making your COVID vaccination online. If you are having some transportation challenges, don't miss your shot. The Comet bus system is offering free rides to get your vaccination. Not only are they doing that, they're also going to start next week vaccinations on site at the Comet bus system. That's going to happen beginning next week at the Comet bus system. Also, if you're having some challenges with funeral expenses, if you lost someone due to COVID, you may be able to get a reimbursement from FEMA. Call the COVID-19 Funeral Assistance Line number. You see the information on the screen and see if you can get a reimbursement from FEMA. The Richland County Rental Assistance Program is open and still has funds available. RichlandCountySC.gov. The NAACP Housing Assistance Program is still open and available for landlords, mortgage companies, and tenants. And the South Carolina Bar Association and SC Legal Services have a toll-free number and website for rental and mortgage help. You can see that information on the screen. SC Housing, I mentioned to you earlier this week, is not only getting ready to open applications for information about frontline workers. You see the frontline workers program there from SC Housing, but they also have some information also for folks that just want to get some help. They've got an assistance program available. So visit the SC Housing website for more information. Now, the City of Columbia is continuing their 6-month payment plan for water bills and payment assistance. You can get that up to 75%. And also the Black Lives Matter Scholarship Fund. They are giving out $1,500 scholarships for African Americans that have been affected by the pandemic. Special consideration for those in the transgender community, single parents and guardians, and those formerly incarcerated. We spoke with the ladies from the Family Resource Center, and they are recruiting actors and actresses, no experience needed, for auditions. They're going to do a series of plays based on sexual assault and domestic violence and child abuse. And they're doing these plays to kind of reach people, to tell them about these issues in a less intrusive way. So if you are interested in auditioning, you can see that information on the screen also. I'm Tre Tailor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are streaming live on Facebook on the Tailor Made production page. Would you go over there and hit like and share and follow? Not only will you be able to watch Coping with COVID Wednesday, Thursday, and Friday at 2 p.m., but also the first Monday of each month with George Wallace. We've got a great show coming up this Monday. I'll tell you more about that a little bit later on in the show. We also have a presence on YouTube. Want to say hi to everyone watching on YouTube. Please go over there and hit the subscribe button. And also on Instagram and Twitter. I'm Tre Tailor, and once again, you are watching Coping with COVID. Hey, I want to remind you, want to say hi to Dennis Gill. He says, good afternoon, Tre. Good afternoon to you, Dennis. Want to remind you that you can post and share this information out so we can get the message to the masses, because we're talking about two important issues today. A little bit later on in the show after the break, we'll talk to Rozalynn Goodwin with the Affordable Care Act. But right now, Connelly-Anne Ragley joins us. She is with the Department of Social Services, and they've got an exciting program that you guys are launching, Connelly-Anne. It's Pandemic Aid for Foster Youth. Thank you for joining us. Tell us about this.
Absolutely. Thanks for having us this afternoon. And the Department of Social Services is proud to announce some funding for foster youth, and also maybe children and young adults that have spent time in the foster care system or foster care alumni. And so we are administering money, federal resources that came as part of the $2.3 trillion Consolidated Appropriations Act. And specifically in South Carolina, from those funds, the state, the Department of Social Services will be giving out more than $4.1 million to eligible youth in South Carolina.
Wow. So these are children, as you say, that are in foster care or used to be in foster care.
That's correct. And they must also fit into the age bracket of 14 years old to 26 years old. So these are children that and young adults and youth that at some point were in the foster care system, were in the custody of the Department of Social Services and the state, and either they were reunited with their families, which is always our first priority here at the Department of Social Services, or they were maybe adopted, or they may have aged out or been emancipated, by their 18th birthday.
Yeah. So if there are some young people that are interested in these funds, what can these funds be used for? I think you said education.
Sure, absolutely. So this is a reimbursement program. And so these federal funds can be used for things like meeting basic needs like housing assistance, access to technology and other expenses, food and utility bills, also transportation. And that can help with getting that first car or maintaining a vehicle. And it can also, there's extra rewards and federal dollars to help cover the cost of education. As it stands now through our Chafee and our education training voucher program, that these youth would be eligible for $5,000 per year towards their academic pursuits of whether a 2-year or 4-year education. Under this Consolidated Appropriations Act, that $5,000 for education goes to $12,000. So this is a great opportunity for a young adult or a youth that has experience in the foster care system. If they are looking to gain new skills and move not just for a job, but for a career path. This is a great opportunity. And I also mentioned things like food and access to technology. And if they're behind on rental assistance or rental payments, if they're behind on utility bills, that as a reimbursement, what the eligible youth would do would be to send us a copy of the bill. I know we're going to talk about some of those specifics to get more information. But that youth would send us a copy, and then we would make the payment directly to the vendor. So it really takes all the work out of it for the youth. And it's just a great opportunity. And that's something we're sharing the word because based on our information, we expect that 3,847 young adults in South Carolina can benefit from this federal, and this is directly tied in response to COVID-19 and the pandemic.
Wow. So foster youth and alum age 14 through 26, as you said, several ways they can utilize the funds. Now, if they do want to participate in the program, what do they need to do?
Sure. So we've got all of this information and more on our website at dss.sc.gov. We've also set up a hotline for youth to call for more information. As of today, we've received over 300 inquiries in the last week. So we're really thankful to folks like you for helping us spread the word. That phone number is for more information is 803-995-0835. And we have a dedicated specialist in our independent living and folks who specialize in that transition to adulthood who answer that line that can help address questions or concerns or kind of outline the process and how the reimbursement system works. And we also have the independent living email address, independentliving@dss.sc.gov. And we've got lots of information online, and we're getting the word out really through social media and through traditional media outlets, as well as sending a mailing to the last address that we have on file for those over 3,800 youth. So we are really just trying to encourage youth that now is the time, that it is okay to ask for help. And we know that youth that have experience in the foster care system are more likely to face incarceration, to struggle to complete their education, whether it's a GED or a high school diploma, and that they could also face other like lifestyle changes, like unintended pregnancy. And so we really want to support these youth at the Department of Social Services.
Yeah, this is great, Connelly-Anne, because like you said, we all are having challenges anyway. Let's just get COVID out. You have challenges when you live life. If you're in the foster care system, you have additional challenges, and then put COVID on top of that. Then you're thrown into another pot. So I love that this aid is available. And I'll tell you, that's one of the good things I think about COVID, that their help is here. You can't even say help is on the way. Help has been being funneled into a lot of communities. So I love that these funds have been earmarked specifically for foster youth.
Absolutely.
Yeah. So I think we've got two young people that we want to hear from. Let's listen to this.
Me personally, I would use them to help with rental assistance, and I will also put a little to the side in my savings account just for a rainy day. The goal is to save up to get a better managing vehicle, and with these funds, I'll be able to handle my rental issues as far as also making sure that I have money to the side.
Yes, I have had a lot of economic problems as far as housing and utilities. Being that I'm currently in college, I do live on campus, but for the summertime, it can be a problem. I also have problems with tuition, so my tuition needs to get paid. I cannot always take a loan.
So that's great. So these are two young ladies who are already in the program and have already received the funds. Is that correct?
That's correct. So you heard from Elijah, the first young lady, and she is a phlebotomist at a local hospital.
Man, wow.
Here in the Midlands, and she is pursuing a nursing degree at Midlands Tech. And we also heard the second young lady is Robin, and she is studying, and she wants to be a pediatric neurologist. And she is a student at Columbia College. And so both of these young ladies, along with about 12 other youth, make up our youth engagement advocates, which is a youth advisory panel that we just launched about 6 months ago. They actually had their first in-person socially distanced gathering last week, but they've been meeting strictly online, and they are part of our as we call it, so that youth engagement advocates to help spread the word for other maybe youth that have aged out of the foster system or have been previously involved in the system, to let them know about these kinds of supports. And as you heard Elijah say, that transportation and housing are issues for her. And Robin, her schooling is so important to her, and she has worked so hard. And these are just examples of how these funds can be used.
I love that, because, sometimes you just need a little helping hand. Sometimes it's just the little things that make a difference between you going one way or another. Evelyn Hay Primus says, very intelligent young ladies. Thank you, Evelyn, so much for joining us. Want to remind you guys to please post and share this information out, because I'm sure you may know of some foster youth that could benefit from this foster youth program. They've got pandemic aid. DSS is administering pandemic aid for foster youth and alum ages 18 through 26. So Connelly-Anne, after they apply, how long before they apply to, the time then they're able to receive the aid?
Sure. And so this is a reimbursement program. And so, that a lot of it has to do with when the youth provides those receipts to our independent living office. But we are committed to turning those requests around quickly, because the money is here. And we just have to make sure that the paperwork is appropriate and everything matches up. But just try something you just said to me, just made me think. I mean, imagine being a teenager or a young adult is hard enough as it is, right? Beyond COVID, beyond just being, trying to make your way in the world. But imagine that if you didn't have any supports or any family or anyone to help guide you, or no mentors or anything like that. And so that's part of the reason that we have established and that we continue to work through this transition to adulthood, because many foster youth and foster children in this state don't have that traditional support or that traditional network that other children do. And that's where we're here to step in and help these youth.
Yeah, that is so incredible. Once again, this is so good. It is the Pandemic Aid for Foster Youth program from DSS. So please let the folks in your circle between the ages of 14 and 26 who alumni or are actually still in the foster youth program know that there is help for them, and they can get, as you said, reimbursed for some of the needs we heard from the two young ladies: housing, getting a car. All of these things are eligible for reimbursement through this pandemic aid program. Now, is there a time limit, Connelly-Anne, that they need to engage in this program?
I'm not right now that we know of, but I would encourage. I know that as September comes and the end of the federal fiscal year, we would just encourage folks to get those applications in sooner rather than later.
Yeah. Okay. All right. So if people want more information, this is the flyer. And can you give us the phone number and the website or the email address again, Connelly-Anne? And do we have it to put up on the screen?
Sure. So the phone number is 803-995-0835. And that email address is independentliving, so 2 words put together, at dss.sc.gov. And actually, if you go to our homepage, it's one of the first things that you'll see on the scrolling tab. It says COVID-19 update, and there's a link right there to the information, some questions that folks may ask, as well as a way to go ahead and initiate the process.
Awesome. So people can go to the website, which is dss.sc.gov.
That's correct.
All right. dss.sc.gov and find out more about the Pandemic Aid Program for foster youth and alum ages 14 through 26. Needed resources, important resources for foster care youth, just to give them a little helping hand. This is so exciting and so incredible, Connelly-Anne. Thank you so much for joining us. I know you're going to be back in a couple of weeks to talk about some other things. I know you said you've got what coming up? The senior citizens can get some free vegetables, you said?
Yes. So it launches tomorrow, our senior farmers market nutrition program, and that runs May 1st through June 1st. And we're excited. We're going to start getting the word out. And this is a great program. I think we served over 19,000 seniors in the state of South Carolina last year. It's free money. It's $25 worth of vouchers that you can use at participating farmers markets pretty much throughout the state. So that is next up.
Awesome. And senior citizens, is that 65 and older?
It is.
Okay. And if people want information
I don't
about,
consider 65 to be old.
I don't either, girl, but I'm just asking. I'm just asking. So how do people get the money?
Sure. So they have to fill out an application online.
Okay.
And that does launch tomorrow on our website.
All right. So that's, again, dss.sc.gov. Evelyn has a question, Connelly-Anne. Is the assistant for Columbia area teens only, this pandemic?
No, it's statewide.
It's statewide, Evelyn. So anyone in the state of South Carolina can apply for the pandemic aid for foster youth. Thank you, Evelyn, for the question.
As long as that youth in question has documented experience in the foster care system, if they were in the custody of the state through the Department of Social Services, and they fall into that age category of the 14 to 26.
All right.
So they have to meet those two variables.
All righty. Connelly-Anne Ragley with the Office of Communications and External Affairs with the Department of Social Services. Thank you again so much for the information. dss.sc.gov. You can get information about the pandemic aid for foster youth and the senior citizens, 65 and older, free farmers market, fruits and vegetables. You can get a $25 voucher to get some fruits and vegetables for free. Go to the website for more information. Connelly-Anne, go and pick up your babies. And thank you again so much for joining us. I appreciate you.
Have a great weekend.
Absolutely. You do the same. Hey, coming up next, we're going to talk with Rozalynn Goodwin with the South Carolina Hospital Association, the ACA, the Affordable Care Act, Obamacare, call it what you want. But it has been extended. And not only that, there are more benefits for those of you who have not registered for health care. But if you have, there are even more benefits for you. Rosalyn's going to join us next to tell us all about it on Coping with COVID. I'm Tre Tailor.
Coping with COVID with Tre Tailor. Updates on the pandemic and information to help you thrive and survive COVID-19. Brought to you by SCDHEC. Visit scdhec.gov for testing and vaccination sites. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council presenting Wellness Wednesday every week on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Agape Counseling and Training Services. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, offering free rides to get your COVID vaccine. Don't miss your shot. Visit catchthecomet.gov. Javis Financial Services, with over 20 years of experience. Computers Unique, Dutch Square Mall. Honest, professional, reliable computer sales and service. Palmetto Media Connections, connecting media and communities together. Coping with COVID from SCDHEC. In it together, SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Javis Financial Services, Computers Unique, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there and it gets me everywhere I need to go.
We try to ride every single day.
Comedy is our livelihood.
You can eat what's good to you and good for you, too. Yes. Get the Dash for Southern Soul Cookbook free. All you have to do is ask. It's packed with delicious Southern-style recipes with a healthy twist.
Yummy.
You won't be able to taste the difference, but you will be able to feel the difference.
Yeah.
Inbox your email address to the In It Together or TaylorMade Productions Facebook page, and you'll get it straight to your mailbox. The Dash for Southern Style Cookbook and a Coping with COVID face mask. From In It Together SC, the Diabetes Advisory Council of South Carolina, and Coping with COVID.
Coping with COVID with Tre Tailor.
When it's time for you, I have all anything, money, finances, access to. That's what save you money. Davis Tax Service. Only tax drive through. Davis Tax Service. Look up, come to you. Davis Tax Service. Handling your money out of our Davis Tax Service. Now you know what to do.
Visit Davis Tax Service today, 803-419-1001.
Computers, they're a part of our everyday life, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall, 803-351-5821. 803-351-5821.
Our lives have been turned upside down by COVID-19. When a vaccine becomes available, it's critical that all of us get it. What we do as individuals will impact everyone's health, including those who can't get the vaccine. We won't get through this unless everyone takes part. Now is the time to get up to date on all recommended vaccines for both kids and adults. Experts say it's more important than ever for everyone to get their flu vaccine this year. And if you're older, you should get both the flu and pneumonia vaccines, since both illnesses can make COVID-19 even worse. Vaccines are available at a lot of convenient places, so be an example for friends and loved ones and encourage them to get vaccinated too. We all want to reunite, travel, and get back to school and work. But that means we all need to get on board. This is the time to do what's right for each other. Get vaccinated. It's our best shot.
Hey there, y'all. I'm Tre Tailor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are streaming live on TaylorMade Production page on Facebook. Please go over there and hit like and share and follow so that you not only can watch Coping with COVID Wednesday, Thursday, and Friday, and also first Monday, you can also get all of your COVID-related updates. We're also streaming live on YouTube. I want to thank everyone for watching on YouTube and ask you to please hit the subscribe button. So Rozalynn Goodwin joins us. She is with the South Carolina Hospital Association. We've been telling you about the ACA extension, the Affordable Care Act, Obamacare. People call it different things, Roz. And it was so exciting to hear that the deadline has been extended, because I remember us talking before the previous administration, the two previous administrations back, we talked about had really extended it out a long time so more people could get registered. And then of course the previous administration didn't. And then when we were talking about this, I think the first extension was in May, if I'm not mistaken.
Right.
And I remember you're saying, I'm just not sure what's going to happen. And then here it is. Folks have till August now to register. Tell us about that.
So the new deadline for the special enrollment period for the Affordable Care Act is now August the 15th. But that's not really the most exciting news due to the Relief Act that was just passed. There are more people who qualify for the Affordable Care Act now. So we literally had people who looked at their coverage options on March 31st, and then looked again on April 1st, and their premium, their out-of-pocket costs went from $300 to $60.
Wow, that's huge.
In a matter of a day, as of April 1st, there are brand new benefits available for people, even if you have already signed up for the Affordable Care Act. I really encourage you to go back again. If you had an agent assist you in getting signed up, call them back and see whether you qualify for a more generous tax credit or subsidy for your health insurance.
Yeah.
We literally saw people save hundreds of dollars per month just with this, what was included in the Relief Act.
Yeah,
what was included in the Relief Act is more generous subsidies, and then there was no limit or cap on the people who could qualify for the Affordable Care Act. So before, if your income was over 400% of the federal poverty level, you didn't qualify for a subsidy at all.
Okay.
That has now been done away with, at least for the next 2 years. If you listen to President Biden the other night, he is proposing that that stays permanent. But we do know that through 2021 and 2022, there's no cap on income for those who qualify for subsidies. Of course, the subsidies are more generous the lower your income is, but they're available.
Yeah, that is amazing. That's what I think is even the more exciting thing. I think it is great that if you don't have health care, if you didn't make the last deadline, you've got several more months to do it. But to me, the more exciting thing is that, and even for those people who maybe didn't enroll because they didn't think they could qualify or get anything, is that because of this new stimulus money, more people can get even more subsidies. That's very exciting. And as you said, I mean, you know someone that went from $300 out of pocket to $60.
Yeah.
That's huge savings. That's huge savings during a time when we need it the most.
Huge savings. And that was the purpose. We know that because the labor market is so volatile right now because of the pandemic, there are a lot of people who lost health insurance because they lost their job or they lost hours on their job. And the job is usually the source for health insurance for 70 to 80% of Americans. Mm-hmm. So you lost your job, you probably lost your health insurance. And you may be listening to this or watching the replay and say, well, I have my health insurance. But I promise you, there's someone you know, there's a relative, there's a niece, there's a nephew, there's a cousin. There is someone who possibly lost hours or lost a job and they lost their health insurance too. And they just don't know that they can qualify for health insurance through the Affordable Care Act. And even if they tried in February or March, they qualify 9 times out of 10, they qualify today as of April 1st because of the Relief Act.
Wow. Gwendolyn Bethany Barnes says this is great news for her daughter. And then you've got the information. People can sign up 888-998-4646. Call for free to sign up 888-998-4646. And Roz, this number is good whether you used an agent or not, correct?
Correct. We talked to a lot of people who said, well, I tried to call the nationwide hotline and I had a hard time getting through, or they told me I didn't qualify. Mm-hmm. We have created, and we have great partners here right in South Carolina who can walk you through the process, let you know what your options are, and get you signed up over the phone in a matter of minutes.
Wow.
So you're talking to someone in South Carolina who understands that your plan needs to include your preferred doctor, your preferred hospital, to make sure they are in network. Because you can be talking to someone outside of our state who doesn't understand our healthcare system or our hospitals, and you can end up in a plan that doesn't really meet your needs, and you go to try to see your physician or go to your hospital and it's not covered. So we're really encouraging all people in South Carolina to talk to someone in South Carolina. The help is here and it is absolutely free. You pay nothing to talk with them, and they will walk you through the entire process and can get you signed up over the phone in a matter of minutes. 888-998-4646 is the number that's on the screen. Right. Take a screenshot, write it down, make the call even while we're on if you got your computer. And although the deadline has been extended until August 15, we don't want you to just kind of, well, I've got time.
Right.
You're wasting time of being covered. And this is not the time to not have health insurance.
Right.
We're still in the midst of a pandemic.
Yes, ma'am.
So within 30 to 60 days, depending on which day you signed up, you will have health insurance, you'll have coverage, and you'll be able to have those well visits to stay healthy so you can prevent, in case you are exposed to COVID-19, that you're able to maintain your health because you've got other things in order, whether it's a chronic disease or other things that are really making it complicated for our population and communities of color in particular to be able to survive when they're exposed to COVID-19.
Yeah, Roz, you make such a great point about preventative health care. You know, it's easy to say, I don't need insurance for whatever reason you think you don't need insurance. But, you know, we hear this over and over again. The pandemic has certainly, and I say this all the time, not that we didn't know, I think Black folk knew there was a disparity, you know, for some reason, it's an amazement to other folk, but I digress. But there is, and we know that we are predisposed to everything: heart disease, diabetes, obesity, stroke, cancer, you name it, Black folk gonna get it first. And when you are dealing with something like a pandemic, which we're still in right now, you've got those pre-existing conditions, so you're going to get hit harder. So it's so much more important now than ever to make sure that you have those preventative visits, like you say, that you're seeing your doctors, that you're getting whatever it is you need. And what a great time, what a great benefit of COVID that we're getting. Just like I was saying to Connelly-Anne with DSS, that we're getting all of this COVID money to do some of the things that we need to do. And healthcare is definitely one of them. 888-998-4646. The Affordable Care Act has been extended, as Roz said, to August 15th. But what she's saying now, which is huge, is that if you didn't qualify before, and if you did qualify before, you could get more. You could get more right now.
And there's even, you might have called before and you were between jobs.
Right.
And you couldn't say with any certainty that I will make a certain amount. Because South Carolina did not expand the Medicaid program under the Affordable Care Act, which is a whole nother show. But because we did not do that, we have not done that yet, you needed to make a minimum amount of income in order to qualify for a subsidy with the Affordable Care Act. Now, because of these extensions and the provisions in the Relief Act, unemployment benefits qualify as income. And it may be that you can get signed up for unemployment benefits, and you can do that with this same convenient toll-free number, 888-998.
You can get signed up for employment benefits?
They can sign you up for unemployment benefits. So you may call and say, okay, I'm between jobs. I don't have any health care. Our agents at this number can get you connected and take you through the process of unemployment, which is it can be a taxing process to qualify for unemployment. They can walk you through that process and then also follow up with you to get you signed up for health care based on those unemployment benefits.
Wow.
All with one number, 888-998-4646. So you might have called months ago and you didn't have income and you just were disappointed because there was nothing in place for you because of where you live and you fell in a coverage gap. This year and next year, because of what was just passed under the Biden administration, unemployment benefits can help qualify you for health care benefits through the Affordable Care Act too. So if you didn't qualify because you didn't have income and you didn't have unemployment, you can sign up for unemployment and qualify. If you did sign up before, call back again. You may have a more generous tax credit now, and you could save hundreds of dollars. Some people are, because of the new provisions. If you made too much money and you didn't qualify in years past, this is the first time that you can make over 400% of the federal poverty level and qualify for some level of subsidy. This is the first time ever. So call the number. You may be surprised what you qualify for. And I just outlined 3 different scenarios.
Yeah.
You might not have qualified before, but you may qualify now, and it costs you absolutely nothing to
call and find out.
Right.
888-998-4646, 888-998-4646. Post and share this information out, because I know you know somebody that needs health insurance, maybe couldn't qualify, somebody between jobs, unemployment, all the scenarios, letter D, all of the above. Please call 888-998-4646. Evelyn Hay Promise Roz says, for seniors who are paying too much for their insurance, can they qualify?
For seniors who may have Medicare, the Affordable Care Act is not for someone who has Medicare. But the great thing about this toll-free number is that they assist people with Medicare plans too. So it sounds like you may be talking about someone who has Medicare, but maybe has a supplemental plan to help them pay for their prescriptions. That's the same number can help them with that too. That is separate from the Affordable Care Act. Because you can't qualify for Medicare and the Affordable Care Act, just like you can't qualify for Medicaid and the Affordable Care Act. The Affordable Care Act was created for those who don't qualify for health care coverage at all. You don't qualify for Medicaid, you don't qualify for Medicare, you don't have health insurance provided from your job. But that toll-free number can assist seniors in identifying different opportunities with more affordable supplemental Medicare plan. So they can do that too. It really is a one-stop shop.
Yeah. Thank you, Evelyn, for your question. Here's a question, Roz. If you qualify for Medicare or Medicaid, do you have to take it? Can you check and see if the ACA can give you a better plan?
Well, you won't be able to qualify.
Okay.
If you qualify for Medicaid or Medicare, you can't refuse it and say, well, let me take the ACA.
Okay.
You are automatically not qualified for the Affordable Care Act because you qualify for those.
For one of those
services.
All right. So call 888-998-4646, 888-998-4646. The healthcare has been extended to August 15th. And even better than any of that, you could qualify for even more subsidies, less of a payment. It just so many more scenarios, as Roz just said. If you are unemployed, if you were unemployed when you applied a couple of months ago, apply again. You just never know. And maybe your income changed, maybe your household changed, apply again. If you didn't apply for whatever, apply. If you did apply, reapply. and I think I told you before we got on the show, I've been getting a lot of emails from healthcare.gov saying, reapply. You may be able to get more. So
yeah, that's good to know that there's that outreach that's going out there. Yeah. We all got to do our part. And, I just always ask anytime I'm talking to a group, virtually or face-to-face, someone in your sphere of influence who can use this information. So you just hitting the share button, you taking a screenshot, sending it to your family group text. Somebody can benefit from this. And a lot of times we're thinking about certain populations, but I was talking with a group of people, these changes really impact even folks who before were maybe hesitant about leaving. Some people are on their jobs just for health insurance.
Right. You're right about that, girl.
Really. Yeah. Some people just stay on their job just for health insurance, but they, have a business that they're working on and they, really just afraid to take the leap because of healthcare benefits. That's a big deciding factor.
Yeah.
I was just telling a group of entrepreneurs, I was just like, if health insurance is the only reason why you're on your job, this really may be the time for you to look.
Right.
At least 2021 and 2022, you have this extension of these benefits, even if your income is over 400% of the federal poverty level. Like I said, President Biden has proposed to permanently put that in place. We don't know how Congress will respond to that, but we do know that 2021 and 2022, there is no cap in who can be considered for those benefits. So you may be thinking, this was not for me. I don't have low income. Like, you really might need to call this number. You should call this number, even if your income is higher than 400% of the federal poverty level. You probably now qualify for some level of subsidy, and you need to compare the type of health insurance you now have that you're paying out of your pocket with no assistance to healthcare insurance through the marketplace.
Yeah, because here's Roz, who wouldn't want to save money?
Right.
Who doesn't want to save money? You know, it doesn't matter how much money you're making, $1 million, trillion, gazillion dollars. You know, it's those folks who are saving money any way they can that are growing their money, growing their portfolio. Yeah. So if this is an opportunity, I mean, you made so many good points. If this is an opportunity for you to save money, definitely call. And the other point you made, if you've been thinking about branching out into entrepreneurship and healthcare was the only reason why you stayed, listen, at least for 2 years, you can get your healthcare. And maybe by the time this is, you never know what might happen by the time this is over, your business may be able to, you may be able to get healthcare through your business. So you just never know. So get it while the getting's good, girl.
Right. And I do. I want everybody to hear all the different scenarios we presented, from unemployment to I have made too much to qualify before. All of those lines are done away with right now. Yeah. Because of these extension, because of the Relief Act, and because of everything that's just been extended as of April 1st.
And this is a South Carolina-based number, 888-998-4646. As Roz said, this is a great number to call because these are folks here in South Carolina who can talk to our specific needs here in South Carolina as it relates to income, insurance, things of that sort. Oftentimes that healthcare.gov phone number and website, it's hard to either navigate or you're on Forever Hold. And here's the thing, and like Roz said, even though the deadline is August, don't wait till July 31st.
No.
Not only because you don't want to wait that long, because it's going to get the lines are going to get harder to access, but you can go ahead and get it so you can start saving money now.
Right. Start saving money now. Get your appointments in now. Yeah. Honestly, sometimes you may be calling to establish a new medical home with a physician, and you may not be able to get in right away. So if you are anticipating, if I've not had a well visit in a year, 2 years, 3 years, don't you want to hurry up and get to someone and get checked out, making sure all of your signs are where they need to be. Like, don't wait to access healthcare when you can access it faster by going ahead and getting signed up. You wait until the deadline, it could be October before you get to a physician. Yeah. If you don't already have an established relationship and medical home, and that happens with anybody. I was trying to get my daughter in for a dental appointment. It was just pushed way back. So, and we've been with that practice for a while. So don't delay thinking that I'll wait till the deadline. I've had until August. You may have your card in, September, but you may not be able to get into your doctor until October.
That's right. Yeah.
So just get signed up today.
Let's go ahead and get signed up today. Again, the number is 888-998-4646. Can they still go to signupsc.org also, Roz?
They can, but that website will direct them. The best way and the fastest way to talk with someone directly is to go ahead and just call that toll-free number, because the website will direct them to that toll-free number.
To the phone number.
And literally, when you call, there are only a few things that you need. You'll need to know, have with you Social Security numbers of all the family members that are filed with your tax return, birthdays. That type of information, a good estimate of income that you expect for this year. So those basic needs can start that conversation. Of course, I'll ask you some follow-up questions, but we've hosted phone banks and I've seen people get signed up 10, 15 minutes. Wow. They had those things with them and they were ready to sign up. There's so many different plans. They are available from many different carriers across South Carolina. High deductible plans, lower deductible plans based on what your needs are. And these agents can assist you with, figuring out, you don't anticipate having a whole lot of healthcare needs. It may be that you pay a lower premium versus a higher premium if you want a lower deductible. So all of those different options are there. When I'm doing interviews, we'll see people commenting, all those deductibles are too high. It depends on what type of plan you choose.
Right.
There are high deductible plans and there are low deductible plans. And depending on the situation that you are in, one may be better than the other. And, a certified agent here in South Carolina can help walk you through those different options to say, okay, what's the pro, what's the con of having a high deductible plan versus a low deductible plan? Do you have a chronic disease that you anticipate seeing a doctor more often? Or is this really just for you to have well visits and those kind of things? So many different plans are available. Like I said, don't dismiss this based on what type of category and income and population you were in and what you thought you knew about the Affordable Care Act. It really is wide open this year and next year. So call the number, look again, call for the first time. There are a lot more options that are available for you.
All right, 888-998-4646. Evelyn says, I'm sure this information will help a lot of people. She said she did without insurance for about 5 years when she became self-employed, just like you said, because I couldn't afford what I was paying for insurance when I was teaching school. I mean, she's talking about exactly what you're saying. Yeah. And a lot of people are dealing with that right now, but here is a chance for you to get the all-important healthcare coverage. So please call that number, 888-998-4646, 888-998-4646. It won't hurt you to call and at least ask, what can they do? What can they do for you?
That's right.
So give them a call. Rozalynn Goodwin with the South Carolina Hospital Association. Beautiful. Thank you so much for joining us. And thank you so much always for advocating for the underserved community and the overserved community. But you're always out there making sure people get the information that they need. And we sure do appreciate it. 888-998-4646. Rozalynn Goodwin with the South Carolina Hospital Association. Thank you, Roz. I appreciate you joining us today on Coping with COVID. Okay. All right. So you saw the number. Go ahead and call and post and share this information out. So someone needs health insurance or has health insurance can get the information they need. 888-998-4646. Listen, if you have a story or initiative that can help someone cope with COVID, please go over to the Facebook page and TailorMade Production and inbox me. I would love to get your story on coping with COVID. You have a product or service that could help someone cope with COVID. The email address is scrolling on the screen. Please email copingwithtreitailor@gmail.com. And we would love for you to be a proud sponsor of Coping with COVID, just like SCDHEC, the City of Columbia Office of Business Opportunities, also Agape Counseling and Training Center, Computers Unique, Dutch Square Mall, Javis Tax Service, 20 years of serving the citizens of South Carolina, the Comet Bus System, and of course, Palmetto Media Connections. Coming up Monday, it's first Monday of the month, and George Wallace, historic legendary comedian George Wallace, is going to join us on Fun Day Monday. And we're going to be joined by the Fifth Circuit Solicitor Byron Gibson here in Richland and Kershaw counties, and also attorney Kevin Kears. And they're going to talk about policy, policing, and the people. We'll talk about the George Floyd case. We'll talk about policing in South Carolina and more. That's Fun Day Monday. Hopefully it'll be fun conversation. It's an informative one for sure here on Coping with COVID. Of course, on Wednesday, SCDHEC, In It Together SC, and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday on Coping with COVID. I'm Tre Tailor. Hey, don't forget about the Dash for Good Health cookbook, a great cookbook with Southern style recipes that are healthy. It's so easy to read, even for the novice cook. Go ahead and check that out. And hey, do you want a copy of it? We're giving them out for free, and we're sending them to you. All you have to do is put in the chat, I want a Dash for Good Health. Give us your email address. Someone will contact you and get your mailing address, and we'll send it out to you. It's a Dash for Southern style cookbook, along with a Coping with COVID face mask. I usually leave you with a reading from Jesus Calling, and I'm going to do just that today. It's April 30th. Can you believe it? When some basic need is lacking, Jesus says, time, energy, money, consider yourself blessed. Your very lack is an opportunity to latch on to Jesus in unashamed dependence. When you begin a day with inadequate resources, you must concentrate your efforts on the present moment. This is where you are meant to live, Jesus says, in the presence. It's the place where I always await you. Awareness of your inadequacy is a rich blessing, training you to rely wholeheartedly on me. The truth is that self-sufficiency is a myth perpetuated by people and temporary success. Health and wealth can disappear instantly, as life can itself. Rejoice in your insufficiency, knowing that my power, Jesus is saying this, is made perfect in weakness. You don't have to be strong. You don't have to be everything, because on Christ, the solid rock, you stand. That's your Jesus Calling for today, April 30th. I'm Tre Tailor. Until the next time, I wish you peace, abundant blessings, good health. Don't forget to get your vaccine, and you still got to wear your mask over your nose and under your chin. See you guys.
Coping with COVID with Tre Tailor. Updates on the pandemic and information to help you thrive and survive COVID-19. Brought to you by SCDHEC. Visit scdhec.gov for testing and vaccination sites. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every week on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Agape Counseling and Training Services. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, offering free rides to get your COVID vaccine. Don't miss your shot. Visit catchthecomet.gov. Javis Financial Services, with over 20 years of experience. Computers Unique, Dutch Square Mall. Honest, professional, reliable computer sales and service. Palmetto Media Connections, connecting media and communities together. Coping with COVID from SCDHEC. In it together, SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Javis Financial Services, Computers Unique, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.